Dr. Uzma Mehr in segment 1, Hornell Mayor Shawn Hogan in segment 2.
Next on News Talk AM 1480 WLEA, the Newsmaker Show with Kevin Doran.
It's Brian O'Neill in for Kevin Doran, talking with Hornell pediatrician Dr. Uzma Mehr. Dr. Mehr, thanks for joining us today.
You're welcome. Glad to be here.
Dr. Mehr, we talked before going on the air. You and many others in the loop believe that a lot of people in the Canisteo Valley area don't understand yet how limited the new North Hornell facility will be. I think the perception that many in the area have is it's just going to be a change in location. It's just a matter of closing down the Canisteo Street Hospital and moving the hospital to North Hornell. Can you tell us what the future of medical care in the area is going to be like with this new North Hornell facility?
Well, I think at this point it's a little bit unclear because Albany still has to make the final decision. And according to the plans that the hospital administration has put forth, there is going to be an outpatient surgery center, and there's going to be an emergency room that's going to house some observation beds. I think about 10 is in their proposal, and they will also have an outpatient presence in affiliation with Oak Orchard. And Oak Orchard is planning on housing family practice, pediatrics, and they have discussed bringing in adolescent psychiatry and dentistry. All those things are dependent on having practitioners here and a facility. But I think that since these plans are pretty much basic at this point, with needing Albany's approval, we still have the opportunity to make changes to this plan. We still have time to, as a community, to work together and see if they will hear us out and put in inpatient beds and possibly even leave maternity in so that our pregnant women can receive health care in their own town and not have to travel. And also the elderly who cannot travel, especially in the winter months, that they have some form of care, at least temporarily, unless they need something more critical.
How many inpatient beds are you talking, Dr. Mehr?
Not many. If they can house, our average census, I believe, has been in the teens. If they can have at least 15, 20 beds, I think that will meet Hornell's need.
Maternity wards. A maternity ward being part of the plan. You'd like to see it be part of the plan for North Hornell. How many beds there?
At least 4. I would definitely like to see maternity wards stay because Steuben County has the highest rate, one of the highest rates of teenage pregnancy. And with teenage pregnancy comes along high-risk pregnancies. High-risk pregnancies need care, immediate care. And those babies are usually, sometimes they're sick, sometimes they're small for gestational age, sometimes they're infections. There are lots of things that go along with high-risk pregnancies. And I think having a maternity here and having pediatric immediate NICU care here to resuscitate and to stabilize is going to be a key factor in helping these babies survive and these mommies get care. We have the MOMS program, which helps them out a lot. I'm not sure if we no longer have a maternity, if all these programs that help the teenagers and people without health insurance will still stay in town.
At the December 4th town hall meeting at the Main Place on Main Street in Hornell, you spoke at one point about the hospital in Dansville delivering around 300 babies a year, and you said Hornell delivers around 300 babies a year, and you were under the impression that Dansville would not be able to handle another 300 babies coming in from Hornell. Can you tell us about that?
Yeah, it just makes sense because Dansville's the size of Hornell. If maybe a little bit bigger, but it certainly, I believe it certainly can't handle that many deliveries. I know Wellsville, with Dr. Rubert going there, There have been some comments from some families that, they felt that that there wasn't enough space. One family mentioned that they had to be boarded in a call room, and that's just the situation with just Dr. Ubert being there. And with Dansville being closer, just 15 minutes away, they will have to make some adjustments in their facility to be able to compensate for the load that Hornell is going to bring there. It's going to definitely increase the deliveries in the maternity ward and the rate of babies that they're used to handling there.
You seem to want a modified version of the current plan that they have for St. James Hospital. How can the people listening to this show right now make that happen, make it so that there is a maternity ward in the new facility in North Hornell, and make it so that there are more inpatient beds?
The community really needs to come together and work with Shawn Hogan. The mayor is working very hard with all the resources that he has, and if the community can pull together and become a single voice to tell these politicians their needs, then I believe we do have a future that's better than that's been laid out for us in terms of health care in Hornell. I do believe that we can save the hospital if everyone pulls together and can let people in Albany know how important it is for us to have a hospital in Hornell. Maternity services and inpatient beds should be part of the plan for the future here.
We're talking with Dr. Uzma Mehr, a Hornell pediatrician and St. James doctor. Dr. Mehr, some local doctors who have spoken out on this subject, they've been saying that the big concerns, and you've touched on this, are going to be for the people suffering from heart attacks and strokes, the older people usually, and those having babies. There has been some concern about people trying to make it to Dansville or Wellsville or Bath in an emergency, and the question is, if there is a new facility, will people go to North Hornell, or would they try to make it to one of those other locations? And if they were extremely sick or there was a problem, what if they don't make it in time?
I think the critical patients, as it happens now, get transferred to a higher level care facility, such as Strong Memorial Hospital. And I don't see that changing, because no matter how many services we bring in, we will not have a fully functional ICU here. And those patients who are critically ill need ICU care. So that I don't see changing. But I do see people having dehydration, people having pneumonia, people having mild heart attacks, people needing care for a few days stay in Hornell. And that is really important for the families who can't travel, because they have their loved ones near them, and they have people seeing them every day. It keeps their spirits up, versus them sitting all alone in the hospital room in Strong for even the simple things, or even going to Dansville in the middle of winter. It's just not possible that the HAT buses go all these places and keep them communicating with their family members.
Okay. Any final thoughts before we go, Doc? Was there any topics that you wanted me to bring up that I haven't raised yet?
No, I think we've covered it. I really feel it's sad what's happening to Hornell, and I've been here 12 years, and it feels like home here. And I just think that this uncertainty needs to come to an end, and we need to have realistic plans, and plans that are going to come to fruition, not just be dreams that they're selling us. I think they need to lay down very clearly what is going to be in Hornell and what is not. And I hope it happens soon.
Okay, Dr. Uzma Mehr, thank you very much for joining us.
Thank you.
And Mayor Shawn Hogan is coming up next. Brian O'Neill in for Kevin Dorn on in segment 2 with Mayor Shawn Hogan. Mayor Hogan, thanks for joining us.
Well, it's good to be with you, Brian.
The hospital administration, as we know, want to close down the Canisteo Street facility and have a building in North Hornell where there'd be apparently an emergency room, 2 surgical suites, some doctor's offices, but critics say it won't be a full-service hospital. Now, there's some speculation going around that among doctors that I've talked to at the hospital is that this new North Hornell facility might not work out because they don't know if they'll get the grants yet, and who knows if anyone's going to want to go to it after all the bad publicity. Your take on that, Mayor Hogan?
Well, I think there's a whole lot of things to be worked out yet. Certainly I'm pushing for a limited inpatient presence and maternity services, and as they outlined at the town hall meeting, they will have emergency room. They'll have outpatient surgery, ambulatory surgery. They'll have lab. They'll have diagnostic services here, X-ray, things of that nature. But I still think that this community can and should demand an inpatient presence. And like I've said before, this is a contrived crisis. It's because the parent organization of St. James, CHE, now Trinity, has decided they don't want to run this hospital. I think that they owe it to the community to try to right the ship and try to make it work. And we're not asking for the moon. And if there's going to, we're giving up. Right now we're licensed for 119 inpatient beds. Certainly we don't need that amount. I think we could live with, 15 inpatient beds locally based on the census. But, we're just shifting our negative payer mix. They say it's highly weighted inpatient care with Medicaid and Medicare patients. We're going to shift those somewhere else, so then they'll start feeling the burden. This is not a plan that's well thought out, and I think they're just looking to this disrupt process, this Medicaid redesign, because there's money there. But I think this has to be more of a thought process on all the parties involved. There's no criticism of the people. I know the people are working hard to try to preserve the services that that they think we are most needed here. But we still are a community. The city of Hornell is 9,000 people. You take in North Hornell and Arkport and Canisteo. We're quickly up to within 5 mile radius here. You're quickly up to 15,000 people. So it does not make sense to have an area that's twice the size of both Dansville and Jones to be absent inpatient care and maternity services. It's going to impact the quality of life, and it's certainly going to be a detriment to our community. That's why we have to fight this. We have to fight for and demand the same services that other communities get. Now, not every community has a hospital. I understand that. But we've had this hospital for 125 years, and, I think with a little TLC, tender loving care, and some quality management, they can right the ship. And the reason they can't, the reason they're not trying or attempting to, is because this disrupt won't allow the status quo. And that's where the money is. They're going to say, well, no, you can't try to make things better, because if you do, you don't qualify for these funds. And that's what it's all about. So that's really, I think everyone has to take a break, start thinking about this, and say, let's really look at this from a common sense aspect, because they're not changing the payer mix; they're going to go somewhere else. and they're going to impact somebody else. So let's look at the problems and try to solve those problems. So that's my perspective on this. And like I say, I'm not being critical of anybody. Although I am being critical of CHE Trinity, because they're the ones that have put us in this situation, merely because they don't want to run the hospital anymore. There's a lot of hospitals in tough financial conditions, but they finally said, we're not going to do this anymore. We're walking away. That's the problem, and it should be looked at for what it is. It's an abandonment of this community by our parent organization. Period.
The idea of not having inpatient services anymore, that was introduced in early October when St. James CEO Jen Sullivan sent out an email to employees, and the same email to the Evening Tribune. The email said a lot of things, but summing it up, it said that the hospital in Hornell could no longer sustain inpatient services. This letter from Jen Sullivan came as a surprise to many in the community because it followed what seemed to be good news back in July that St. James got $6.4 million from the state health department to keep going until early 2015. So in the summer, it sounded like maybe things were going to work out. And then October hit, and Sullivan sent out that email to the Tribune and to the hospital employees. Now, appearing on this station on October 13th, hospital CEO Jen Sullivan said the funding runs out at the end of March. And the $6.4 million, do you know what that was used for, Shawn?
Well, that was used to fund the losses at St. James. They didn't take the opportunity to manage the hospital and make some changes that would right the ship. At the end of the day, Trinity Health CHE is going to be gone. Now, in reviewing some of the issues of this situation, it looks like St. James, in reviewing their financials, they pay $2.3 million per year to CHE or Trinity to be a member of that system. So if we're not going to be a member of that system anymore, you take that $2.3 million away, that automatically cuts the $4 million loss per year by more than half. So right there's a cost savings right there. And so, so you've already cut your loss by more than half. Let's talk about some other things you could do that would at least give you a break-even position as far as the hospital goes. I don't think that Noyes or Jones are really in any different situation than we're in. They just happen to have a relationship with the University of Rochester Medicine, and this really played into the hands of this Medicaid redesign. So, like I say, not being critical of any of the partners, everyone's trying to do the best they can for Hornell. But I think time out, put the brakes on. Let's really think about what's happening here and come up with the best outcomes that we can. And that is a limited inpatient presence, 15, 20 beds locally, and maternity services.
Okay, question for you, Mayor Shawn Hogan. You say that $2.3 million is paid by St. James and Hornell to parent corporation CHE Trinity. Didn't Trinity pick up the total debt from Catholic Health East, and what was that debt, and did any of that $2.3 million go to that debt?
I think the total debt is about $13, $14 million. I don't know. I haven't seen the exact figures, and I don't know what the exact figures will be. But wait a minute, if you own the assets, you own the debt. They're not doing any great favors for this community if you're taking the assets and you're selling off the assets and the proceeds for those sales go to you, then if you own the assets, you own the debt. So I don't know if that's a big deal or not. They're portraying it as that, but let's think about it. But not to stir up controversy or anything like that. I think this process has got to be looked at in depth, and we have to take a in-depth look at it. And this isn't. I think is all being driven by this Medicaid redesign. And I don't know if that's going to serve the best interest of our citizenry. So that's what I'm pushing for, and I'll continue to push for it. And, everyone has their own agenda. I'm looking out for the best interest of the community, and I'm sure everyone who, from St. James administration feel they're doing the same thing. They're trying to take, trying to preserve and as many jobs and many services as possible. I'm saying let's just stretch it a little bit. Inpatient beds are important to any community. It's important that we have them, especially maternity services, particularly with the transportation systems are inadequate and our roads are substandard to have to get where we have to go. Those issues have to be addressed, and they can't be ignored. So that's all I'm asking. So let's see how things shake out.
You mentioned Medicaid design and the DYSRP, DRSIP money.
Well, yeah, that's what it is. Medicaid, it's the delivery system redesign. That's what the Medicaid is. That's why they have this big pool of money, $8 billion that the federal government gave the state to reform the Medicaid system in New York State. New York State is participating. They got $8 billion, so they have all this money. So that was the path of least resistance to go, because there's money there, and that's driving the whole process. And because they're not going to allow the status quo, and it's for the sole purpose of reducing hospital stays and reducing hospital beds. I'm not too sure this is that's the best place to put the St. James situation. So, but that's where the money is, and that's why we're pursuing. That's why it's being pursued, and that's why we're placed in the situation we're in. So, there's a whole lot of different things going on here, and I don't expect the general public to understand. What they have to understand is they have to raise their voices and write Trinity Health, write their elected officials, and speak up and defend themselves and demand the health care that they deserve. Bottom line.
Mayor Shawn Hogan, thanks for coming on the Newsmaker Show today.
No problem, Brian. Thank you for having me. Thank you.
News is next here on AM 1480 WLEA Hornell.